Welcome to SMA's Southern Medicine podcast. Practicing medicine in the southeastern United States presents unique challenges for healthcare professionals. The South's heavily rural population and limited resources require medical professionals to be more resourceful in their approach to providing quality care. SMA's Southern Medicine podcast addresses these issues by drawing on the experience of healthcare leaders who provide a multi-specialty, interdisciplinary team approach to medicine for the purpose of providing better care for the Southern patient population.
My name is Andy Mohan, and I'm the chairman of the Division of Digital Health and Innovation for the Southern Medical Association. I'm also joined by Miss Jennifer Price, who's the educational manager and will be joining us in the discussion with our guests today. I hope everyone is doing well and is practicing safety and listening to recommendations that have been put forth. For example, social distancing. Please stay safe, everyone. We want everyone to stay safe during this very tough time. We want to come out on this being a society that is more united and prepared for future crisis and or pandemics. Today, we have a superstar guest for you all, and she's going to speak about mental health and coronavirus, which is a hot topic right now with everything that's going on. How do we stay in a good mental health state? Her name is Dr. Anandhi Narasimhan. Dr. Narasimhan, or Dr. Anandhi, is a child, adolescent, and adult psychiatrist practicing in Los Angeles. She is an independent contractor for a nonprofit organization called Masada Homes and has a private practice. She is also contracted with Teledoc, which is a telemedicine platform. Dr. Narasimhan is an asylum evaluator for Physicians for Human Rights and has had numerous media appearances, including CNN, CNN International, Fox News, USA Today, The Tavis Smiley Show, along with other appearances. Thank you for joining us today, Dr. Narasimhan.
Thank you for having me.
First of all, we appreciate it. First of all, I'd like to ask you how you're doing with all this craziness. How's your family? What's your perspective on this current situation?
It's a very surreal time that we're living in. A lot of changes, both small and large. And I, as a citizen and as an individual and as a healthcare professional, I'm trying to do my best to make sure those around me and my patients are educated about how they can keep themselves healthy and safe, and also, protecting my loved ones and making sure they understand what precautions to take, and just trying to do my part. Yeah, and personally, this week I've received a lot of phone calls and requests to discuss how people can manage this time, manage their stresses. What are the logistical and healthcare implications that I am witnessing, and kind of my thoughts on going forward. So I'm trying to do my best to contribute my expertise to helping manage the pandemic.
Well, we truly appreciate that, and I think that everyone needs a good perspective in terms of mental health to kind of understand what we're all going through. Right now, I think all of us, not only the adults, the children, and how to tackle something like this. What are the risks to our mental health during a pandemic overall?
So there's actually several layers to this. First of all, the first thing is that there's a complete disruption in our day-to-day living for so many people. They've had to, their children are not in school. They've had to figure out how to arrange for childcare. For many people in the restaurant industry or service community, where their jobs depend on customers coming in, their jobs have been affected. So they've had to kind of think about long-term implications of that. So these are things that cause stress and can cause anxiety, and also, for people who are already struggling with anxiety or obsessive compulsive disorders, this can be very challenging because it just adds another layer of environmental stress that they weren't anticipating. So it can exacerbate already existing symptoms. So it's complex, and there are many factors that are involved.
So yeah, I do want to get back to anxiety and how we can probably mitigate anxiety and how to treat something like that. But before we go into that, I want to kind of find out what recommendations you have for parents who are working full time. A lot of us are working full time and working at home.
Mhm.
And we have kids at home, so they're at home with us. And so what do we do to ensure that, first of all, they have less screen time? Because the kids now, they're probably sitting there, they're watching a lot of things on TV, so less screen time and to somewhat prevent that cabin fever.
Sure. Yes, this is a very big problem that I'm hearing from many parents, and in how to manage this. First of all, I think it's interesting. We're also learning how many jobs have things that can be done from the home. So many things we thought couldn't be done from home, or we're actually seeing can, including so much of telemedicine. There's a lot that can be done from home. So for people who are employed full time to work from home, that's a reasonable solution at this time to help minimize exposure. For starters, others who are in like the healthcare industry or work at hospitals where their presence is mandatory, that's a little bit more challenging, and it's going to involve some innovation and creativity in figuring out how to arrange child care. And I recently heard that there are medical students who are volunteering to babysit doctors' children so that they can go to their shifts, because the medical students don't have classes, so they're volunteering their time to do that, which is wonderful. So I think to be on the lookout for opportunities or uh, people that are willing to fill in the gap. Secondly, for children at home, this is a very a time of shifts, and for a lot of my child patients and children that I see, they of course weren't expecting this. And for a lot of children who deal with mental health issues, structure is very important for them, and their structure is completely disrupted during this pandemic, having to stay at home. So it can be challenging for both the child and for the parent. Some of the things that can get exacerbated are dynamic issues between the parents and children. If there's already a lot of difficulty with the interaction between parents and their children, that can be exacerbated when you're in a small enclosed space and there's not the ability to escape, whether it's at school or activities. The other thing is a lack of physical activity can also cause restlessness and just feeling that there's pent up energy that can't be released. So it's important that we figure out ways to keep children physically active. There is actually research showing that when we look at ways to manage things like anxiety for children, the behavioral activation part of it, which is physical activity, is just as important, sometimes even more important than the cognitive piece, where we do exercises with them to help change their thinking. So these are the challenges that can come into place. And also, of course, there's this issue of screen time, both for children and adults. When you're at home and you can't do a lot, and what is available to you is a laptop and a tablet or a phone. That's what games and other things that just kind of usurp your time. So that's something that really can be difficult to manage. I mean, I know of children who just completely fall apart when their electronics are being taken away. So that can be a very challenging time. So as a parent, it can be really good to be prepared. I mean, we're all focusing on the attitude of preparedness to manage this pandemic. So in the same respects, managing your preparedness to deal with your children having a meltdown over screen time. So it's probably a good idea for you to understand what you're comfortable with. Is an hour okay a day or 2 hours okay? I don't recommend several hours of screen time for children, you know, with the exception of if it's school-based, if it's learning, if they're learning another language on their tablet or things like that. Kind of getting a clear idea of how much time are you okay with your child being on the screen, and how much time would you like them to allot for physical activity. You can create a little bit of structure at home as well, just having the rules and saying these are the rules and these are kind of what we have to stick to gives them some structure as well, because the structure of the school setting has been taken away. So you can give them some structure at home. Hey, I expect you to, you know, for us to do as a family some physical activity, and I will give you this amount of time for your electronics use for the day, but I don't want you using it all day long, with the exception of nothing else to do. And this is also a wonderful opportunity to like introduce the love of reading. I mean, I've talked to several of my child patients in the last 2 weeks and have encouraged them, do you have books at home? Can you get books? You know, what are you reading? Like, you know, encouraging the love of reading is very important for the future scholastically, and it also helps with their boredom. It helps them learn things. So making sure that there's other things available besides the screen time, whether it's workbooks or coloring books for younger kids, and you know, projects involving like crafts or building things, so that there are other things for them to do.
That's amazing feedback on that. One thing I wanted to touch on in terms of what you said was, first of all, I want to thank all the medical students that are going and helping these families with children. That's great. We love it. We need more of you guys, and we very much appreciate that. In terms of what we're doing with social interaction or social distancing, how do we ensure that our children's are getting that proper stimulus in terms of socialization with other kids? And what are we going to do there? Because if it's 60 days, it's 60 days. But if it keeps continuing to where we're going to be doing the social distancing, how are we going to get that social interaction or the socialization that are important for children, especially the growing children, or the younger guys that they're just so used to going to school right now. And just kind of give you a little background, my children, my oldest he's in teleschool, so his school has set up a platform where they're going to be providing the same education through teleschooling, which is interesting. So he'll have some amount of socialization. But for other children, they may not have something like that set up, or their schools haven't done it. What are they going to do, and what's your recommendations on something like that?
Sure. So, you know, I was on another podcast earlier this week, and on there we were discussing this issue. The question was, how do we keep up a child's academic performance, social engagement, and emotional health during this time. And I kind of, my attitude is this: one, their physical health and the physical health of other people in society is the top priority for me, as a psychiatrist and as a physician. If I have a child patient that is struggling or is in a mental health crisis, my number one priority is not their academics so much, it's their mental health. I need their mental health to be better, and improve, and eventually, oftentimes, that can result in an academic improvement later on. But the top priority is their physical health. So during a pandemic, the number one priority is the physical health of these children and those around them. There is some evidence, although we don't know a whole lot about the specifics of this virus, but there is evidence that younger children seem to do better with this virus, but we are hearing of cases where some children are being tested positive and having some symptoms related to the virus. So we do have to protect that part and keep that in mind. As we know, children can often be petri dishes, so it can exacerbate the spread to other children and other adults and other family members. So that is the challenge with this pandemic. With that said, we don't want to completely have them live this isolated existence for an extended period of time where they lose out on that social interaction. So there's a couple of ways to help fill in that gap. One of my colleagues has scheduled go-to meetings for her daughter, her 8-year-old daughter, to have play dates with her friends over FaceTime, so that she does have some interactions. That's one way of doing it. Phone calls. There's, luckily with technology, it also allows for some more connection. So there are ways that kids can communicate, for example, through your child's teleschool program, that there can be some kind of social engagement, even if it is an ideal face-to-face interaction, that there is some occurring virtually or over the phone. So, when I think back to being a teenager, and I had strict parents who didn't let me go out late and things like that, my go-to was the phone. I would just talk on the phone with my friends, and for me, that gave me a sense of socially connected when there were restrictions on other things that I could do. So, and then I think strengthening your communication with your children during this time, just, building that bond, using the time to just put aside your own electronics and just have face-to-face interactions with your children. One of the things I had said earlier is that parents can also look at this as, hey, this is a time where I don't have to run around and be the parent that drives my kid to this practice and this soccer meet and this recital and this, and because all those things aren't happening right now. So right. Instead, you can use that time to just kind of hang out and interact with your child. I had read something long ago about an author had written that his 4-year-old had come up to him and said, Dad, I'm bored. I don't have anything to do. I'm bored. And he responded, that's good, because you can learn how to handle this feeling, learn how to manage it, figure out a way how not to be bored. So this is kind of something a lot of parents with only children worry about, like that they don't have enough social engagement with other siblings, even though there's also some data to show that sometimes sibling interactions can be so negative, more than like having a bully at school. It can be just as like traumatic having like a sibling bully. But parents who have only children really often worry about this, but they figure it out. They figure out ways for their child to be socially engaged and socially connected, and we can do the same. That being said, we hope that this isn't for forever. This isn't a super extended period of time. And then the other thing to remember is part of the stringency in maintaining the social distancing right now is to flatten that curve, to contain the spread of the virus, so that over time we can be more socially engaged after we stop the numbers from exponentially increasing.
As we are socially distancing, this is an article that I read, and this kind of came up when you're talking about this, and the anxiety that we're all feeling with staying at home and not being able to do the things that we're normally used to doing. I read an article in China after all of this happened, because of the confined state and your prolonged having to stay in your house for quarantine or whatever reasons they had, social distancing. There was an increase in the number there was an increase in divorce. So is that something that we're going to experience here? Because there may be situations now that people are going to work, and obviously you come home and you may have a struggle, a very difficult relationship as it is right now. Is that something that we're going to see here, and it's going to exacerbate to in terms of relationships or families? And how's something like that? How do we mitigate something like that? Do we go on hikes, maybe, to kind of just get out of the house and relieve stress? What do we do to mitigate that coming from our perspective here?
So I think that there are things that we can do on an individual basis that can help our relationships with other people who we live with, whether it's a spouse or a live-in partner or a roommate, and we can help improve that relationship and make it peaceful and supportive, because we need support during this time. So one of the things is figuring out ways to de-stress yourself and to kind of manage your own emotions. There's so many mindfulness apps that are available. There are instructional videos on how to meditate, on how to do yoga. And these are things that can be done at home by yourself. And these can also be very transformative and powerful in terms of relaxing yourself and giving yourself time for reflection and correction, reflecting on, hey, you know what, my partner made me really annoyed yesterday. Why did I feel so annoyed? Kind of processing why that happened, and like analyzing your thoughts around that and why that happened, and is there a way to look at it in a different way? Are you being overly negative or overly critical of that person? And what steps can you take to improve that relationship? It's also one of the positive psychology exercises that has been researched is practicing gratitude, writing a gratitude journal of what you appreciate about that person. What do you enjoy doing with that person? What would improve feeling connected to that person? And sometimes, getting some fresh air and physical activity is also very, very powerful for us in terms of our own health and our social relationships as well. So going out for a walk where you're practicing social distancing can be useful and powerful. We have these stairs. They're city owned stairs that's near my property, and my husband went to run up and down the stairs for exercise, and he said there's so many people trying to do the same thing. So just kind of finding places that are not as populated to get some sunshine and physical activity is very, very, very useful. You want to make sure that you are getting both those things. In terms of when there's a conflicted relationship, this is a challenging time for that, when we have to be inside and in close living quarters where you can't get away from that person. For some people, their relationship kind of survives because the two people are busy and they're both working and they don't spend that much time together. So that's kind of a buffer. So in a time like this, they may be stuck together, and it may just exacerbate whatever existing problems, or create more problems with communication, as evidenced by the article you said. This is also a pretty scary time for a lot of domestic violence victims, because one, if they have small children, they may be thinking about, if I need to escape, where do I go? Do I go to a hotel, or do I go to a shelter where I may expose myself and my children to catching the virus? So these thoughts may be going in through their mind. And also, if they can't get out of the house easily, or they can't just go to a friend's place who has children of their own or a family of their own, because people may be with practicing social distancing, they may not be as open to helping somebody else out or giving them a place to stay during this time. So if you can imagine, if you're in that situation where your home is not a sanctuary, it's actually a very scary place, this can be very challenging. So all the more that it's important that these individuals find an online community, or a community that can help them navigate these issues through this time. If they need to go somewhere, if they need to find a safe place, a lot of people live with partners who have substance abuse problems, and that can be exacerbated during this time, and kind of managing that and finding resources for help with that. I just dealt with a situation where I had a patient who when he withdraws from a substance that he has an addiction with, he tends to get seizures. So here I am wondering, can this be managed as an outpatient basis? Or normally the standard of care would be to hospitalize that patient so that they can be detoxed. But now we have to make some of these challenging decisions about how to keep someone out of the hospital, or, how do we help the domestic violence victim that has nowhere to go. So all of these people exist in our society, and ones that need to be taken care of and thought of.
So a lot of these, and you already you've touched on it in terms of the anxiety and how to mitigate something like that, and with relationships, and in terms of people that are struggling with their emotional issues right now with social distancing and all of those different things. How can we? What can they do to get help? Is it something where you could just log on and get help immediately, or how do we access healthcare for, or how do we give people the access that are struggling emotionally?
So I just got an email from my health insurance company saying that they are now opening up telemedicine portals so people can access their health care through telemedicine. There are many, many therapists out there who and psychiatrists who offer teletherapy and telepsychiatry services, myself being one of them. I work for Teledoc, which is a national company that services the needs in both family practice and psychiatry. There are companies like that. A lot of insurance companies are contracted through an organization like Teledoc or other telemedicine. And I know that nationwide, there is this push to kind of make more telemedicine services available to people. So you can just search in your area for teletherapists and people who offer services through telemedicine and teletherapy. And I think most of my colleagues are transitioning to seeing patients virtually. I know I have for the time being. So a lot of people are offering these services virtually. So there's one option is contacting your insurance company and going that route, and then doing a search on your own of provider or professionals in your area who offer teletherapy services. There's also numerous online support groups, and NAMI is the National Association for Mentally Ill. They have a lot of resources. The American Psychiatric Association and the American Academy of Child and Adolescent Psychiatry both have posted several resources for people to access care during this time.
Do you feel that telemedicine is as effective for patients as seeing them face to face in an office?
Yeah, well, years ago when I was a psychiatrist at Cedars-Sinai, I was I was introduced to telepsychiatry. In the beginning, I was like, "What is this? How can you replace a face-to-face interaction?" I was totally opposed to it. I was like, "How can this work? And it's not right. It doesn't seem fair. It doesn't seem ethical." But I did notice number one, we were able to service the needs of so many more patients than if I would have to face to face. We were able to see patients who lived in the most rural areas. Some of them were 100 miles away from their own primary care doctor, let alone a specialist such as myself. So I found how powerful it was that we could service the needs of people through telepsychiatry. There's also been research done on quality of care and patient satisfaction with telemedicine services. One of my patients told me recently that having access to telemedicine has been such a lifesaver to her, because she had a yeast infection and she would have had to wait like 2 weeks to see her primary, and she was able to get the medication she needed over telemedicine sooner than that. So yes, I mean, and this is look, part of the purpose of technology is to improve our lives. I'm actually part of a research trial that is looking at digital therapeutics and artificial intelligence to improve early detection and identification and early intervention of certain issues related to mental health. So I think now is definitely the time to use these technological advances to our advantage to help patients access care and get good quality of care. I think that using telemedicine and teletherapy is not only opportune at this time, but it's also very necessary. But the one problem we are having is a lot of these telemedicine portals and servers are getting overloaded because everyone's trying to use them. So there's been a little bit of an issue of that, and that's being worked out as we go. But I think these services are vital right now.
What about for a lot of our demographic in the South, Southeast, they're smaller rural communities, and you may have an older population that may not know how to use. I'm saying they may not know how to. I don't want to say older population, but there's a population that probably doesn't know how to use a computer. They may not have the hardware. They don't understand the software that well. What are we going to do there? Because they may not even have the bandwidth. With the internet technology, they may not have something that they're gonna have access to something like this. I feel that may be an issue. Do you feel that's an issue as well for the rural communities out there?
Absolutely, absolutely. So just something somewhat related. is my mom had so much trouble using a smartphone when I got her one. And, downloading apps like Uber and Lyft were just going to be, it wasn't working. So I found a service called GoGo Grandparent, which is connected to Uber. So it's for grandparents, the elderly who have trouble using smartphones. They use their flip phone. They can call this number from home, and then somebody comes and picks them up. And I get a text message saying that she's been picked up and that she's been dropped off. And so that service really was wonderful. So that's kind of the way we have to look. So many of my patients don't have internet access or Wi-Fi, don't know how to use it. Some of them who are dealing with more severe mental illness can't even, they're unable to kind of follow instructions or be able to get set up to do that. So what we do for those patients, and I work for a nonprofit where we do a lot of community outreach. So our therapists and case manager, the whole treatment team is out in the community. So they go to the patients. Some of my patients are homeless. Some of them live in sober living facilities. So they go to them. They don't have them come by themselves to us. And these patients don't have laptops and things like that. So what we're doing is we have our service professionals go to where the patient is and use their phone or their laptop so that they can have access. When I did telemedicine in Cedars-Sinai, what we did is a lot of times we saw these patients at their primary care doctor's office or another neutral location where there was a social worker or case manager or somebody there that has this set up. And that equipment was more encrypted, so they needed a particular setup. And then the patient would be brought there, and then they would do it that way. So, unfortunately, a lot of people are, as you've described, who either are unable to access technology or don't know how to use it or need help with it. And the people that come up in my head that need this kind of someone checking in on them to make sure that it's available to them somehow, whether it's somebody else bringing it in. A lot of the elderly who live alone, who don't have access to the internet, I met an elderly man who still uses the telephone book to look up stuff because he doesn't use the internet. So those kind of folks really do need community outreach, somebody to go and make sure that they're able to access these services. And I think in Western society, we have encouraged individualism and achievement and kind of emotional self-reliance. But what this pandemic hopefully also teaches us is that we need each other. We need to check on those people who are in need and make sure that they can access care that they need.
So for your specifically your higher risk patients, your patients that you've identified as potential, they're in a suicidal, a very fragile state. How do you deal with something like that if they can't come in to the office, if you're using telemedicine? And then also from a psychiatrist's perspective, what's the liability for something like that you've seen?
Ray, the Jamesons, that they are the owners of the Saddleback church. I might be getting that wrong, but anyway, they're the founders. They lost their son to suicide, and the mom gave a talk that I'll never forget. And she said, as a psychiatrist, I know that many of you have long days, you get tired, you may feel burned out, but even when you are so tired and you've had a long day, that last patient that walks in, please make sure you show them some compassion, because that moment of compassion may be what keeps them alive. So I try to keep that in my head with my patients, because sometimes I think for the health professional, and we're seeing this across the nation now, is it becomes overwhelming when you have so many really sick patients and they're all having a crisis, or they're all sick, or you're not able to access resources as well as you'd like. So it gets overwhelming, and it's sometimes it's easier to just kind of try to distance yourself more. But I try to challenge myself and do the opposite. These patients that are really struggling, I try to schedule more frequent check-ins. And if I can't do it in person, I make sure I'm calling them. I have a mental list of the ones that I'm more concerned about, and I'm making sure I check in with them frequently. I'm making sure the therapist is checking in with them, because that connectedness is really vital and really important. So if I have patients who are really struggling, we increase the frequency of virtual visits, we increase the contact, and we do more frequent check-ins. And we also discuss as a treatment team how we can focus on preventing any adverse outcomes and how to keep them safe. So we make sure we discuss that. And in terms of liability, I think, accurate proper documentation is important. So I'm, in all, actually, I've also been noting that I've been discussing with my patients the precautions to take during this pandemic, because my patients who don't have TV, who don't listen to the radio, they are not getting the information that they need. So I'm making sure I educate them about social distancing and hand washing and other ways to minimize exposure, and I'm making sure I document that as well. So, so that they're aware, and that I have reminded myself that I'm making sure I make that a focus as part of my treatment.
Fantastic. These are all very, very interesting feedback that you're giving, and a lot of people are thinking about these type of things. Coming from both the patient and provider perspective. In terms of your practice overall, seeing patients, have you guys made any specific changes for mitigating COVID-19 during this crisis, and how to prevent things? What changes have you made within your office itself?
Okay. So we've done 100% virtual. And I was a little nervous about how that was going to do it, but the nonprofit I work for, Masada Homes, the leadership has been wonderful in figuring this out very quickly. They've transitioned all the patients to telemedicine, so I'm seeing them all virtually. All my own, I have a small private practice. I'm changing that completely virtually, and my teledoc patients I was already seeing them virtually, so that will continue. So it's a drastic change, because I have been seeing these patients in person for several years, over a decade. So now we have completely transitioned them all to telemedicine. So
is that across the board though for all psychiatrists? Or is that the new norm for us, that all psychiatrists are going to be practicing or utilizing telemedicine platforms?
I think that's going to be fairly common. For psychiatrists who work in hospitals and emergency rooms, they may be still, of course, physically doing face-to-face interactions. But yes, you're going to see more psychiatrists do things virtually, at least in the interim future, until the numbers stabilize with this pandemic.
So, Dr. Narasimhan, what challenges may exist in the future as a result of this pandemic? Where are we going? What are we expecting here from your standpoint, from a mental standpoint?
Yeah, well, first of all, our mental health is affected by the environment around us. So one of the first challenges is if you get sick, or a family member gets sick, That is a source of stress. If they get more severely ill with this virus, it's, managing, you have to deal with them being sick, and you have to deal with the whole family not getting more exposed and not exposing others. So there's that challenge. And then the emotions run high when you have a family member, a loved one who is physically sick or dealing with a severe illness. That can be very challenging. So and also, there's of course many discussions about shortages of beds and hospital beds and supply chain factors and the availability of masks and all of those things, which can be challenging for both the patients and the healthcare professionals, keeping the healthcare professionals safe because they're at higher risk for being exposed without the proper protective equipment. For starters. The second thing that I see is there's going to be an economic fallout, an economic challenge. I was just reading yesterday about how people aren't going to nail salons and how much, for the nail salon owner, how when business is down, it really hurts them economically, and how they're able to kind of deal with that, or how they're going to pay rent. So these are very real issues for so many people who are dealing with job layoffs or their businesses not performing well as a result. Or people who are in the customer service industries. So I think that economic stresses and financial stresses are huge when people have to worry about, paying bills and paying for food and their mortgages. That adds a whole nother layer of stress for people to deal with. So these are some foreseeable challenges that I see can be potential serious hardships for a lot of people worldwide.
And Dr. Narasimhan, with that being said, that those stresses are going to cause, as I see, it's going to cause a lot of bounce back or non-compliance in terms of medications to hospitals. And is that something that is a cause for concern? Hospitalization, rehospitalization, so on and so forth.
Yeah, so the entire medical community has been told to see what we can do to mitigate hospitalizations and keep patients out of the hospital as much as possible. So, one, the hospitals are not overwhelmed, and then two, for our patients not to be exposed to the virus themselves by being hospitalized. So you admit them for let's say a mental health reason, and then they end up getting the coronavirus and then end up in a serious condition. That doesn't help them. You're solving one problem by giving them another problem. We don't want to do that. So I think myself and my colleagues and others in the mental health community are trying our best to contribute by making sure we reach out to our patients who are struggling, making sure we have frequent visits with them, making sure we're checking in with them, making sure that their medications are being refilled. And this is, of course, a lot to ask from pharmacy staff who have to, go to work and interact with people because they have to keep, people need medications to survive, a lot of them. So just making sure that that's all happening, and that I'm checking in and saying, are you taking your medication, and is it helping you? Are you having any side effects? And doing that as much as I can on a virtual setting. A lot of telemedicine platforms have electronic prescriptions, so you can send the prescription electronically. So we're relying on those services.
Yeah, these are tough times, and we all got to come together so we could mitigate this crisis, this pandemic. What do you have any specific pearls that you'd like to tell our listeners during this crisis, something that they could take home and take as something that's a positive for them?
Yes, yes. I think with hardships, some of the most challenging things that happen to us are also opportunities for great growth and transformation. So I would say let's use this time to kind of focus on our own personal transformations if we can. Taking up a mindfulness practice such as meditation, that is great for your emotional health, that is great for your spiritual growth, and it can really help manage your physical immunity and improve your immunity by like reducing your blood pressure, reducing your cortisol levels that rise during times of stress. So taking up, if it's not an existing practice, finding a mindfulness practice that works for you is, I think, very important to do during this time. You can also use this time to develop a new skill, learn a different language, learn a new craft. I have this audiobook that I need to finish listening to that's about doing mental math. It's a great time to learn something new, and when we learn something new, we improve what we call the neuroplasticity in our brain, the connections and the neural networks. It can be a great time to check in on the elderly and people around you who live alone, who don't have a lot of support. This is a great time to do that, to teach your children to do that, to think of others. When we think of others and when we think about helping other people with problem solving and challenges that they have, it distracts us from our own pain, and it actually makes us feel better. Acts of service do lift us up. So that's something to take up during this time. This is also a great time to work on journaling and kind of figuring out some goals for yourself. And if not that, just learning how to be better present in the moment.
Thank you for all of the information, Dr. Narasimhan.
Sure.
Jennifer, are you there?
Yes.
We would like to hear if you have any questions for Dr. Narasimhan. I'm sure that you have a few things that you'd like to.
I actually do. And it was when we were talking about children and kids. I have a 20-year-old whose college semester got upended. And so as we're talking about, in the context of younger children, obviously, screen time and scheduling is helping them find a routine. And I know for me personally, work-wise, I like having my normal routine, trying to continue that as I work from home. But kind of going back to the older children, these kids who have been upended from college, do you have any advice for them? Because they're adults, but yet in a way, I think in a situation like this, they are scared. They're children, they're wanting to be independent, but some of that's being taken away. And for our son, he's back home, and it's kind of under our house, our rules, and not that he can really go anywhere. But do you have any thoughts on how parents of the older kids can cope, and maybe some advice for the kids themselves?
Yes, I do. For young adults, moving back with your parents is a very humbling experience for most of them.
Yeah.
They were used to having some independence, and all of a sudden they're back to being a teenager again and being treated like one. So that can be quite a challenge. I know it was for me when I had to do that. So I think the college years and the transitioning into adulthood, it offers its own challenges and stresses because it's a time of transition. And there seems for a lot of young adults, it feels like there's a lot on the line. My career, my education, my future, what am I going to do with my life? What do I want to do with my life? So they have all these questions and they're trying to navigate it all. And then there are these disruptions, this big disruption that just happened. But the same thing applies, the same concepts apply at any age to the young or the old. Like physical activity, mindfulness, some kind of structure, taking a walk, just kind of having some social connectedness. These things are also important, for that population. This is also, for that age group. They recently started being able to vote. So kind of this would be a wonderful time for them to think about what values they have and how they can use those values to serve the community. Because we're also, the older generation is going to look to the younger generation to help kind of fix some of the problems that have been created, whether it's with climate change or other things. So we need them. There's also for them, I think there's I know that certain universities are transitioning to online education. So kind of looking whether they can continue their education virtually, if that's a possibility, so that they can continue to get credits without losing lots of time. So I think the same thing applies at any age group on kind of what to do when you're confronted with this possibility. And again, I always encourage people to find a love for books, because when you're engrossed in a story, or reading a nonfiction book, and you're really into it, you're never really, life isn't boring. People who read usually don't feel bored. So that's something that they can really kind of, embrace.
If one good thing could have come out of this, but as we are still socially, distancing ourselves and things, but toward the beginning, my son sort of rediscovered his love of tennis. So he was getting outside, he was getting his exercise while still having some interaction. But even if it just meant going out and hitting balls, on an empty court, it was getting him out, kind of clearing his mind, because his classes are transitioning online. However, he had labs that you really can't do online. So he's kind of stressing about, how am I going to make those up and, continue on the scheduled path that I have? And he's very literal and very structured. So this has been a challenge for all of us to kind of help him navigate. So just getting outside and hitting some tennis balls has done a world of good.
Yeah, and what would be useful for him to know is he's not alone. Everyone is in this together, and everybody, so many college students are dealing with the same circumstance, so that he's not alone in this, and he can continue his education and progress. And also, as a parent, for you, I think what would be helpful as well is just embracing having this time with your child, because I always hear from parents, where did the time go? They just grew up and left, and it happened so fast. So this is a great time for the both of you to
It has
just,
been wonderful. It has. I mean, I hate the circumstances.
yeah.
But we found out yesterday that he will not go back. They had extended spring break, and so now he will be with us, for the rest of the summer. And it's, while it's sort of an adjustment for everybody, as a parent, there was a reason this happened, and I'm honestly glad to have him home.
Mm-hmm. Yeah, my parents always loved it when I came home, and I used to wonder, why aren't you sick of me? But I think that this time can give that gift. If it's giving if there's good to come out of it, there is that gift of the possibility of having more time with your loved ones.
Well, thank you. That helps me as a parent of an older child, because again, like I said, you're walking a line. He's an adult. He's 20, but
Yeah,
yet when they come home to land, they're still your child, no matter how old they are.
right.
Well, Jennifer, do you have any further questions? If you don't, I just wanted to go ahead and thank, I want to thank you, Dr. Narasimhan, for your time with us on this podcast, joining us and giving us such great information. And And we know that your time is valuable, and you should be you want to be with your patients. But this 45 minutes spent, I hope it's going to be very, very valuable for our listeners and other people that may want to subscribe to it. We appreciate it, and thank you so much.
Thank you for having me, and thank you for taking your time to do this as well.
Thank you again for joining us. To subscribe to additional SMA podcasts, please visit sma.org/podcasts.